Hello, everyone. We have a really important and sad conversation we have to have today about really a sad topic. But Dr. Joanna Rubinstin, the president and CEO of Childhood USA, is with us today to help us understand a new report issued recently called Out of the Shadows. Some really important data we'll go through, so stick around. You don't want to miss this episode.
Welcome to the Your Mark on the World show with your champion of social good, Devin D. Thorpe.
This episode is made possible via the support of our sponsors, including Johnson & Johnson's Caring Crowd. Joanna, welcome to the show.
Thank you so much, Devin.
Well, we're thrilled to have you here. We appreciate you taking the time. Tell us just give us a quick overview of the new report produced with your help by The Economist, Out of the Shadows.
Thank you so much for having me on the show. And this is such an important opportunity for me to talk about this new tool that we are hoping, it's a benchmarking tool, is going to help us to address the problem of child sexual abuse and exploitation. The work started almost a year ago with the Economist Intelligence Unit, and it's worth knowing that they are really experts in producing different indices, and they have their researchers all over the world in different countries. We wanted with this report to find a way to raise awareness about child sexual abuse and exploitation, not just trafficking or online child sexual abuse, but also the very, very common form of child abuse that happens behind closed doors. People forget that in 90% of cases, the child actually knows the perpetrator. And this is a universal problem that somehow we don't want to talk about and don't think that there are solutions. So what's really great with this particular report, that it is focusing not on looking how many children are abused in how many countries and where, but it's looking at what are the responses of countries to child sexual abuse and exploitation. What is the environment in which it happens? What are the governments doing? What is the legal framework? What can different NGOs do to address this problem? And also, what can the private sector do to help address this problem? So the research was conducted in 40 countries, both the poorest of the poor and the richest of the rich countries. And these 40 countries represent actually 70% of all the children in the world. And it is the first of its kind benchmarking tool. So if you go to the outoftheshadows.eiu.com website, you can download the report, but you can also, if you are an expert or want to find out more, play with an interactive tool that allows us to see what's happening in each country and how these countries have been answering some of the questions that the report tries to highlight.
How big is the problem as we look at child sexual abuse and child abuse around the world? How big is this?
In the US, we usually use the number that 1 in 4 girls and 1 in 6 boys will be sexually abused before the age of 18. Globally, the numbers vary. And one of the reasons, and this is also one of the reasons why we worked on this report, is that many of the countries are not even looking at collecting the data to know how many children are being exposed to this horrible crime. So globally, very often people talk about that between 10 to 20% of children have been exposed to sexual violence before they turn 18.
It's just horrific to think about. How does the United States compare to other countries in this index?
Well, first of all, it's only 40 countries. So if you rank the 40 countries, these particular 40 countries, US ranks number 5. And We have United Kingdom having the first position, being number one. We have Sweden number two. We have Canada and Australia, and then comes US. So we could say that US ranks relatively high, but at the same time, it's interesting that none of the countries ranks higher than just about 80%, which means that all the countries have a long way to go to really address this problem.
What is the United States not doing that it should be doing?
I think United States is doing quite a lot. We have a pretty strong legislation. However, at the same time, we have 50 states with different state legislation. So it's maybe harder to harmonize the response. We are really having very strong NGO sector. We have a lot of different NGOs that are not only working on prevention of child sexual abuse, but that are also providing services to children who are survivors of abuse, which is hugely important. And something that I'm very proud of is that US was the first country that really established so-called child advocacy centers, which is a kind of one-stop shop when someone suspects that the child is being abused. During a relatively short period of time in the same place, you have social workers, you have a pediatrician, you have law enforcement, and you can very quickly make sure that you know what happened to the child and how you can find a way of protecting the child, getting hold of the perpetrator, and ensuring that the child can heal. What we are not doing is perhaps that we could concentrate more on prevention. We could ensure that by talking more about the problem, not just as a horrific problem and how many children were abused by Dr. Nassar, but in the same articles also trying to address what can be done. How could we prevent it from happening? We could probably reduce the numbers.
What are some of the most powerful preventive interventions that we should be advocating?
I think having standards and really investing more in also better understanding the problem. One of the things we are not too good at in the US is actually collecting the data and doing integrated surveys so we know what is the national situation when it comes to child sexual abuse. Another thing we could do is to ensure that all the institutions that work with children have very specific protocols that at least minimize the risk of children being abused or the perpetrators taking care of the children. We could definitely do more in terms of educating the parents and educating children earlier about what is right or normal touch and what's a bad touch. And I think, one of big problems, which is a universal problem, we simply need to face the truth and we have to talk about this problem. Something else that I think we should be better at is training our physicians, our healthcare providers to be better at recognizing the signs of abuse, and also our educators in the schools.
That's a great point. As we look around the world, though there is much room for improvement in the United States, clearly you identified in this report 34, 35 countries that are doing less well than the U.S. What are some of the problem countries and where are the gaps there?
I think countries in crisis and poor countries, sometimes it may be more difficult simply to have resources to address the problem. We know that countries where we have political crisis, where we have migration, where we have some cultural norms that allow people to abuse children, these countries are faring poorly. But at the same time, the good news is that there is a number of poor countries that are doing well. So it's not just a matter of resources. It's a matter of will and political will as well to address this problem.
Now, what are you most proud of having accomplished so far since you joined World Childhood Federation, or Foundation, excuse me?
What I am proud of is our collective work as the foundation. And feel very privileged that I have the opportunity to work with the foundation and with all the partners of the foundation. I think what has been really important for us in the US is to raise awareness about the problem. And I think by being behind development of such a tool as this new index, or being engaged in fighting child sexual abuse online, because internet can be an enabler, we are contributing in a more substantive way than just by supporting projects on the ground. But I think without the projects on the ground, we wouldn't have the deep understanding of what works and why, and what are some of the solutions that we can use.
What's the most important lesson you've learned since you've been doing this work?
I think I'm trying to apply some of the lessons I learned in my previous work. I think that it is important to really raise awareness and to address a major problem like child sexual abuse and exploitation. We need to find ways to measure how we are doing. And I think this is one of the reasons why we believe that creating an index, creating a tool that is not just to shame and blame the countries, but of course some of them react immediately like, what can we do better not to rank so low? And this is exactly the point. We want them to do better. It also allows the countries to look at what they are doing well and maybe scale it up. It allows them to learn from each other. What is this country doing well? Why are they ranking higher? And that's a good example, for example, if we look at the internet space. In some of the countries, there are very stringent laws that make the operators or the internet service providers take off all child sexual abuse material or provide a way of reporting that. In some other countries, it's being ignored. And this is a major cause for concern right now, and especially in developing countries, where there are no, very rarely, services to support the survivors to ensure that when the internet reaches these children in sub-Saharan Africa and Asia, and it's so important for their education and access to healthcare, markets, entertainment, that it's safe, that it's not being a way of using these children for trafficking or exploitation or even recruitment as soldiers.
Yeah, that's great. Great lessons. Now, you joined Childhood just 3 or 4 years ago. Why is this work important to you? Why did you make that decision?
I have to admit that before joining as president and CEO, I was a board member of the foundation, but I also had the privilege of working on ending poverty in developing countries for 10 years as chief of staff of Professor Jeffrey Sachs. And I felt very empowered how much we could accomplish, of course, in partnership with others with regard to malaria or providing access to education for children in the poorest villages in the poorest countries. And I thought that child sexual abuse perhaps is not that difficult to address. And this was a big disappointment my first year, to learn that people wanted to talk to me about the work in Africa on education and even, providing education for girls and child marriage, but nobody wanted to discuss child sexual abuse. It was easier for me to talk about trafficking. For many people, it's like talking about them, not us. But as soon as I would bring the numbers, the estimates, people would say, where did you get those numbers from? Maybe there is nothing that can be done. Or people were simply avoiding me. And I think I got pretty angry with a lot of people that this is unacceptable, that we have this public health epidemic affecting so many children. And we do know that there is scientific evidence that shows that it leads to mental health problems. It leads also sometimes to different substance abuse and then perpetuation of violence. So we do know that it has horrible consequences, not only for these children, but for the society at large. And still, we are pretending that it doesn't exist. So I guess I'm pretty stubborn. And I also felt commitment to Her Majesty, who has for 20 years been working on children's rights in many countries, trying to find new ways. And so I not only respect Her Majesty for the work she's doing, but she has accomplished a lot. So it felt that I'm in the right place to be someone who can help here.
Excellent.
But we have a long way to go.
Yes, well, a little way. Joanna, what is your superpower?
I guess I am a survivor. I was a refugee child. I grew up as a refugee child. And it's perhaps not giving up, adapting to new challenges, and always trying to find a way to solve problems or to connect with people who can help to solve problems. But I don't think I have one superpower.
I think that's a great superpower. You're very resilient. Well, Joanna, thank you so much for taking the time to be with us today. We appreciate your insights on such a painful topic. Before you go, would you take just a minute and tell people how they can learn more about Out of the Shadows and more about Childhood USA?
Please visit our website. It's childhood-usa.org. And you can not only learn about what Childhood is doing and what programs we support in the US, but you can also download the mobile app that we created in partnership with Darkness to Light, which can teach you about prevention of child sexual abuse. And you can also click on the link to the report, or you can go directly to outoftheshadows.eiu.com.
Very good. Well, Joanna, again, thank you so much for being with us, and we wish you every success in ending violence against children.
Thank you so much for the opportunity to speak about this problem.
All righty, let's do some good.
At Caring Crowd, we believe everyone has the power to make a difference. Through our crowdfunding platform for community health, we empower passionate people to drive real change. Whether you work for a nonprofit organization, volunteer, or want to get involved for the first time, you can post a campaign on Caring Crowd. Join us, because caring is where change begins.
Thank you for listening. Devin Thorpe's mission is to end extreme poverty, improve global health, and mitigate climate change before 2045 by finding and sharing the stories of those who are doing the most good. You can join with other listeners to accelerate Devin's mission by visiting helpdevin.org right now.